Hello, my name is Christina Kinney, and I'm a psychiatric nurse practitioner student at Texas State University. Today, we're going to be discussing the ethical case study of drug addiction. This case study is called I Know What You're Thinking. An African American male patient, age 42, was admitted to a skilled nursing unit after surgery for head and neck cancer with lymph involvement, newly diagnosed. Extensive excision of the tumor has been done, and the patient has a newly placed tracheostomy and feeding tube. His history includes years of living on the street and active drug abuse at the time of admission. This patient is very anxious on assessment, focused on his tracheostomy, pulling on the connections, trying to make sure they are working, and complaining of pain 8 to 10 on a scale of 1 to 10, with intensity focused in the area of his surgical wounds. Although he receives morphine on an as-needed basis, he waits as long as he can to ring the nurse because he worries that asking for pain medication will label him with the staff. He also complains about not getting much sleep and thinking often of the poor choices that got him into this trouble. He has anxiety related to breathing through this tube, like I am not getting enough air in, and ongoing pain which gets less but is never gone. He readily admits to risky behavior which has alienated him from family and social support for some time, but he is willing to discuss his years of drug and alcohol abuse. When the nurses and the attending physician describe the patient's condition, they explain that his anxiety is probably related to being a druggie and that his pain is mostly drug-seeking in nature, as evidenced by his calling for more medication a few times a shift, and that he seems to watch the clock. They also note that this patient is a homeless street person who waited too long to seek help. He hasn't held a job for some time, and he has no visitors. And he is probably using his illness to feed his addiction. The patient in this case study is experiencing provider-based stigma. The providers are saying that he's watching the clock and that all of his problems are due to him being a drug addict. Provider-based stigma can impede access to necessary treatment, such as adequate pain management. Patients who have substance use disorders have high rates of comorbidities. And due to the fact that they experience this provider-based stigma, they actually avoid seeking care at times. Some of the ways we can help these patients is to implement hospital-based addiction consultation services to help counteract the stigma within healthcare systems. These hospital-based addiction consultation services can help the patients with drug addictions. In conclusion, all patients deserve pain relief, regardless of their background. This patient's anxiety needs to be addressed. The patient is also willing to discuss years of drug and alcohol abuse. This is a good step for the patient. Since this patient is not having adequate pain relief with the morphine, the provider really needs to consider other pain medications. And this is where the addiction consultation team would really come in handy. This patient could have an opioid use disorder, and that's why they're not having any relief from the morphine. And they could benefit from a medication for an opioid use disorder, such as methadone. Thank you for watching, and I hope you have a great rest of your day.